So coming to the apnea. So apnea, we have many causes: central, obstructive, mixed. What is this apnea of prematurity? Apnea of prematurity, as the term suggests, it is exclusive for those preterm babies. And the incidence of apnea of prematurity is indirectly proportional. So lower the preterm, higher will be the incidence of apnea of prematurity. Okay, so it is inversely related to the gestational age. Say less than 28 weeks, from 24 to 28 weeker, 60 to 100% can have apnea of prematurity. Beyond 28 weeker till 32, 34 weeks, the incidence varies somewhere between 10%, some studies say 30%. So the incidence will vary. Just understand, it is inversely proportional to the gestational age, and it can be as high as 100% in 24, 26 weeks, and it can be somewhere between 10% in 32, 34 weeks, right? And this apnea of prematurity is basically a diagnosis of exclusion. You cannot just rule out, say, a 32 weeker, you have hospitalized for RDS or something, and then in the first 2-3 days, maybe day 2 or day 3, the baby has apnea. You cannot just tell, okay, it is apnea of prematurity. Apnea of prematurity is basically a diagnosis of exclusion. We are going to read about what are the causes of apnea. Primary causes, this, that is diagnosis of exclusion. Secondary causes, we have a list. After you have eliminated or you have excluded all the secondary causes, you have to think of apnea of prematurity and start the treatment. Okay, so apnea of prematurity, again, this prematurity or preterm babies will have the physiological immaturity, both in their central chemoreceptors and in the peripheral chemoreceptors. So what happens when there is an immaturity in these chemoreceptors? When there is a hypoxia, when there is a hyperoxia, when there is a hypercarbia, it is not going to give a proper ventilator response. Say for example, like neonates in utero. In utero, what happens? Babies in utero, a fetus is actually in a low oxygen state, isn't it? 10%, 20% SpO2 levels are the arterial oxygen levels. It is in a low oxygen state. Once the baby is born, baby is exposed to higher oxygen levels, the pulmonary blood circulation opens up, and when in case you are administering 100% oxygen during your resuscitation, etc., what happens? There is a hyperoxia state. Hyperoxia will be taken as a stimulus, and immediately the baby will go for apnea. Hypoxia, hyperoxia both can cause apnea. Hypercapnia can cause apnea. Whenever there are any disturbances like this, what happens? Central response, brainstem response, peripheral chemoreceptors should understand, okay, this is something abnormal. Okay, and they have to react accordingly. But what happens here? The premature newborns, they will go for apnea. Okay, usually apnea happens after day 2 of life, that is beyond 24 hours of life, and in the first 1 week. Okay, so first 1 week. Beyond 1 week, it is rare, right? So most of the apneas usually occurs from day 2 to day 7. And how long it will last, that is another thing. Why you should know how long it will last? Because caffeine is a known drug for all of you working in your nurseries and NICUs. So how long should you give caffeine? It depends upon the physiological immaturity only. So if the newborn born at less than 28 weeks, he or she, that baby, will have apnea for even up to 40 to maximum 44 weeks post-menstrual age, right? And for a newborn who is born more than 28 weeks can have up to 37 weeks. Okay, so this we should know for us to continue giving caffeine for that particular newborn, right? So this is the course of apnea of prematurity. Why it happens, when it will start, how long is it going to last? So this is just the brief of apnea of prematurity.